My name is Patrick Williams and I'm from Prostate Cancer UK. Well, I've been staffing a stall that has information on prostate cancer, specifically aimed at black men. The engagement was very good because they had a lot of questions and a lot of myths associated with prostate cancer, which was great because we could actually dispel those incorrect informations that have been going out. I think that we need to have more of these, but I think also that to engage with communities more, there needs to be something that needs to be done, and we need to get in there and talk to them.
I'm Dr. Di Aitken, I'm a GP and I'm also on South East London CCG's governing body. My main initiative is providing clinical and strategic expertise in bringing together health and social care in Lambeth. So the work of the Lambeth Together partnership works in alliances that deliver services. So we have a mental health alliance called the Lambeth Living Well Alliance, and then we have a large one aimed at adult health, which is called the Neighbourhood and Wellbeing Delivery Alliance, and I'm the strategic lead for that. And then we also have a Children and Young People's Alliance as well, and a Staying Healthy Alliance. Well, I've spent the afternoon on the health professionals table, so we've been a team of doctors and nurses just taking questions from people and then giving out health promotion information and say, don't just take it, give it to your friends. So we've seen over 30 people in some way or other, some of them much more detailed consultation, and talking to these people that I've seen today, they didn't have good access. And as a GP, you know, I've been trying to help them how to get access to their GP as well. Because again, there's a myth that there's no access to GPs, where in fact there's plenty of access. There aren't many of us, but there was still good access.
Hi, I'm Paula Bryan. I'm the co-founder of Carers for Carers. We've been running fitness classes for everybody, for the community. So we've been doing different things. We've done boxercise, mobility, chair yoga, and we tried the candy dance as well. No, it's been fantastic, and it's great to get the community moving again. That's why events like this are so important, because particularly after the time we've had, it's great to get people out again and connecting with each other and connecting with their services.
My name is Alice Diaz and I'm the CEO at Carers Hub. We're based in Brixton. We are a small charity supporting unpaid carers. A lot of people know it as Carers Hub Lambeth because we're based in Lambeth, so we support unpaid carers who live in Lambeth or care for someone who lives in Lambeth. So they might support a family member who has a physical disability, a long-term condition, an addiction, mental health condition as well. And we provide information, we signpost and refer people to appropriate services as well. And then we run a mix of peer support groups and activities, and that includes adults and young people as well, because we work with young carers from the age of 5. It's important to kind of raise awareness of the service, but also, you know, not only throughout the pandemic, but carers are, you know, their well-being is highly impacted by the demands of their caring role. And I think, you know, being able to prioritize themselves and to look after themselves, that can be a challenge in itself. So because it was a well-being event and it was linked in a local community, I think it's important to be here to speak to people in the community, but also with other professionals as well. I think that's a really good thing to do, because we get to know what's going on outside of our organizations as well.
So my name is Almadina Batista Mendes and I am a specialist lead nurse for school health. My purpose is to bring health alternatives to my community. It's easy to tell people you have to stop this or change this, but if you don't give them an alternative that it's viable, they won't succeed in lifestyle changes to promote their health and well-being. People came, people were happy to sit down and have chats and ask all sorts of questions, and the feedback I've received from those same people is, we want more of this. We want to be represented and we want to speak to people like us. I think representation is key here, because when you have a black GP, a black consultant, a black specialist nurse that understands traditions, cultures, diets, lifestyle, because it's basically the same being from the Caribbean or from the African continent, that culture permeates everything we do. So when you have an understanding of that, you can link to the day-to-day lives of the people that walked in through the doors today. So I think they see that connection and they're able to relax and just be themselves and ask whatever they want to ask. It's been an amazing event, and again, I think I want to reiterate the fact that the feedback was amazing.
My name is Vanessa Rapier and I'm a consultant in sexual health and HIV. And within my work, getting out in the community, outreach is key to that. So it was just a great opportunity to come and speak to the local community, speak about health in general, but also raise awareness about sexual health, contraception, menopause and HIV. There are some people that are, we always say empowered, but feel comfortable using the internet. They've got access to the internet and they can search, or they feel comfortable going to their GP. But there are some that don't and actually prefer that face-to-face interaction, but on their doorstep rather than them going to have to seek it. And so this is great. I think people are different and you need to have different opportunities to engage.
Yeah, my name is the Reverend Les Isaac, and I'm the CEO of Ascension Trust, and I'm also part of the Beacon project, the AT Beacon project. So we've been doing a lot of blood pressure, talking to people about where they could get different help. So signposting is the big thing. I thought it was an exceptional day because you're bringing all these organizations, agencies together, and you're creating the space for people to come and just to mingle, relax atmosphere. And they are meeting and hearing and seeing things, which just means that people are relaxed, they can ask questions, there's food there. I think it's been a fantastic day, atmosphere, but really should have been outside because it's just really good, really good. I think that's very important when people come in, for instance, and they see black doctors, black nurses, when they see black men talking about, prostate cancer. It's so important. And when they see that, then they relax, and then they begin now, whether you're green or yellow or white, they begin to engage because they know there are useful information there for them to get hold of. So I think these kind of things is so important for us to help people to engage with their health, with the services, and really at the end of the day help them from going to the extreme where they may die from their illness. I just want to say to the folks in Lambeth and all the team that's there, thank you for putting this on. As a black man, I feel really good that there's an effort to reach out, to particularly the black and Asian community. There's an effort, and I think it's commendable, and I want to just say thank you.
So my name's Natalie Crary. I'm the Programme Delivery Director for Black Thrive. And we are a systems change initiative that's working to address mental health inequalities experienced by black people, primarily in Lambeth. So for us it was really about raising awareness of the work that we're doing, making people in our community aware of the opportunities to get involved in terms of changing the services that we receive in order to improve our mental health outcomes. It has been a real opportunity to listen to communities, to kind of get an insight into what it feels like to live in Lambeth, but also kind of seeing where there are the opportunities for people to link in with the work that we're doing. So yeah, it's been all in all a really great opportunity, as well as being able to signpost people into services that they may not have been aware of. I mean, this is black joy, essentially. It's like, being able to see people who look like you, who get you, but that is so important because I think sometimes when people don't share your lived experiences, they don't pick up on the nuances and how kind of services or their offer or the way that they communicate with you needs to be different.
So my name is Lewis Gladstone Annan, and I'm here representing my own organisation, Let's Get Active. So we coach or run a series of youth sports programmes in and around Lambeth and Southwark. We're based in local community hubs, but we're also based in an array of local schools as well. And we kind of run that in conjunction with a lot of our mentoring schemes as well, where we mentor young people, not just through their younger life, but through their professional life as well. I think typically with organisations that are often run by the council, they always come with that stigma where not many people want to come. But this is probably one of the first in a while that I've come to where they've really engaged some key stakeholders across the community, and I've seen everyone out today, so it's been great.
My name is Chaka Shombe, and I'm with Carers for Carers. I'm also on a company called Men's Walk and Talk, because it's about men coming together and having an open conversation about whatever they want to converse about. And it's been quite successful. We visit many parks Park tomorrow, we're going to go to Richmond Park. We'll be to Battersea Park, we'll be to Central London, Brockwell Park, all the parks around the boroughs. The conversation has been about trauma, personal trauma, respect, the division between homosexual and heterosexual guys, anything we've had as conversation, and it's just getting deeper and deeper, and more guys have been involved. Last week we had about 13 guys. Tomorrow in Richmond Park we're looking to have a bit more, about 15 up to 15 guys. So it's been a fantastic experience. And yeah, that's it really. That's all I need to say about Men's Walk and Talk.
I'm Adrian Jones, representing two organisations, Men Cry 2 and Your Story. Men Cry 2, we hold a bereavement session for black males who've gone through bereavement, grief, death, dying, or any kind of loss in their life. We hold it fortnightly, and it's a great space where people come together from Dubai, the West Indies, Sierra Leone, all over the globe. We cry together and we hold each other virtually to bring each other back up again. It would be great next time if perhaps we got the young people to advertise the event and have some of the young people from maybe Lambeth Youth Council on board. At Your Story, we're part of the Lambeth Made project around employment and creativity for young people. So I'm going to bring that up, and hopefully we can support Lambeth to get more young people involved, and we have it intergenerational, older people, young people coming together for the whole community.
I just like to come to these functions, so that's why I come. I do exercise and all those things, and dancing, but I didn't get my reggae music.